Hello, this is Dr. Nelson, and today's topic is refinement for clear aligners. But what are refinements? Also known as mid-course corrections, refinements are small alterations that we'll need to make to the aligners during the treatment. These changes can be required in cases where the intended gap closing or tooth straightening is in a shift. This is why progress checkups are required, and the treating doctor will check the patient and decide if there are any further changes needed. The following factors may influence the treatment and have an impact on the main goal: not wearing your aligners for the recommended time, forgetting to put your aligners back in after eating or drinking, breaking the aligners or losing them and not replacing them on time, complex movement and difficult teeth with angulated and long roots, small clinical crowns, and more. And last but not least, cases with new restorations. So, we recommend monitoring all the time every single patient. Monitoring is the key to success. So, we're going to go through different options for monitoring, such as flaws between the suspected teeth, areas where we have misalignment, to check for tight contacts. If tight contacts exist, you can do some hand stripping to create 0.1 millimeters of IPR. If needed, you can always refer to our IPR video in which we explain step by step what you need to do. If there are no tight contacts but there is some misalignment, you can still do a little IPR of 0.1 millimeters to help create some needed space. If you have tried the options mentioned before and feel you've created sufficient space but still have misalignment at this point, you may need to submit a refinement. Another option is always to check the occlusal contacts with occlusal paper marks if needed to remove clinically these interferences. Now we're going to jump into another important topic. If we're having tracking issues, we can also use some auxiliary techniques. So, for example, we can always provide chewy saliva ejectors or cotton rolls if an incisal gap is present between the incisal edge of the tooth and the aligner. Incisal gaps are usually the first sign of a case going off track. Also, another tip that I provide for auxiliary techniques will be the use of the detail pliers. So the tip of the detail plier features is a unique design that can create pressure points. The created pressure point will help us to push the tooth into its intended space in the aligner. It's important to clarify that in several places you're gonna find different types of detail pliers. I'm just going to mention, for example, the vertical one that is going to emphasize over correction of rotations, the horizontal one that helps with individual root work, but also this horizontal one is used for retention. You are going to find ones to help just to circle pressure points to do tightening of the contacts, also the razor plier. That will depend on where you are buying these type of detail pliers. Let's jump into going few aligners back. Backtracking is when you have a patient where the previous aligners longer than originally planned. Often when the teeth have gone off track, they need additional time in previous aligner. Step 2, move fully into position. Indicators for when backtracking may be needed. If we have an incisal gap, if aligners are not sitting correctly, or if there is an incomplete tooth movement. Also, another technique that I can mention as auxiliary help will be the use of elastics. And the use of elastics is totally under the treating doctor discretion. You will need to manually create the cuts, the slits. You can do it with the scissor. You can also use the punch plier. That is up to you and with what you can find on the market. Full Contour does not provide cuts or cutouts planned for elastics, and if you are able to create them clinically, you're gonna be able to use all the different types of elastics techniques that you know. So bootstrap technique for extrusion, triangular elastics for extrusion, vertical elastics for extrusion, rotation elastics. Even if you're doing AP changes, you can provide class 2 or class 3 ones. So how can we avoid refinements? We can actually increase the frequency of appointments. We can extend the wear time of the current step. Also, we can explain the potential consequences of an extra cost. And we can show the patient the potential and results to increase the incentive. So before ordering a refinement, try to hold your patient at the current best fitting aligner. Also, you can send the new intraoral photos with articulated paper marks. Send a new scan or PVS impressions. And last but not least, remove all the attachments before taking a new scan. And the reasons that we recommend to remove all the attachments is because you may not need those attachments anymore. We might need new attachments added, and also the current attachments might have been worn out with weak engagement. So how are we going to be able to submit a refinement with our platform? First of all, we are going to use the credentials and get and log in into the FC platform. We are going to bring the patient in the clinic and take a scan of the upper and lower arch. Also, we are going to require a scan of the bite. In addition, if needed, you can provide intraoral and extraoral pictures. If you did not took a scan of the bite, you can also take those intraoral pictures of the bite so we can mount the case correctly. Don't forget providing the RX so we can follow your specific instructions. As a step 2, when we have all our records gathered, we are going to place them on a file, and then we are going to compress the folder into a zip. Once we converted that file into a zip folder, we're gonna drag and drop the zip folder into the Full Contour platform. Once we drop it, we are going to be able to select Argan Clear Aligners, Anterior Refinement, or Argan Clear Aligners, Full Refinement. We can modify the turnaround time to 24 business hours. We can select between upper, lower, or both arches. We're gonna have to type in the patient's first and last name. And if needed, we can add additional instructions that we did not provide on our RX. Once we finish with this, we're gonna be able to send this new order. Thank you so much for your attention, and let's change dentistry together.